COVID-19 staff update. We got Marilyn up, see Anna coming up, and Dr. Richardson. Go ahead, Marilyn, kick us off.
All right. Well, wonderful. Thank you. Thank you. We're just finishing, and the state will post tier assignments today. So today we've completed our second week of being in the orange tier, based on the data that for the, I think, week ending May 10th, if I recall. Our 8th, thank you. Our metrics based on the absolute number of cases and our rate of vaccine, we're meeting yellow tier metrics when the small county formula is applied. And next week will be the first week, will be the week that we can be considered for moving into the yellow tier. It will be based on data for last week, and I believe for the period of Monday, from May 10th to May 17th, we had stability. We had no new cases added, so we remain at 1,428 cases. So we have good news and anticipate, moving forward in a positive manner. We have our vaccine, as your board is aware, the Pfizer vaccine, the emergency authorization for distribution of that vaccine, the age group was expanded to include 12-year-olds and up as of May 12th. And with that, you're going to see when Anna's going to go over our vaccine rates with you, you'll notice that our rate of vaccination percentages will have shifted because the denominator is going to be changed with because we're including all individuals age 12 and up, so instead of 16 and up. But we're still doing really well, and our vaccination rate of fully vaccinated, as well as at least one first dose, is higher than the state average. So we are just trucking along, and we had a great weekend second dose clinic that went really well, and I believe we got some first doses in also. And I'm going to sort of just turn this on over to Anna. Anna, sorry.
Thank you. Yes, we, as Marilyn said, we've had a little bit of a shift. We talked to your board last week about having expanded the potential to expand use of Pfizer to age 12 and over. That did fully get approved throughout the week last week, and was reviewed by many different federal and regional and state representatives concerned with vaccine safety, and we ultimately had the approval to expand the use of Pfizer to 12 and over last week. So one thing that did was add more people to our denominator when we're talking about the number of people who are eligible to receive vaccines. So last week we reported that our total percentage of our eligible population that had received at least one dose of vaccine was at 72.2% for Inyo County. Now that is including, that's the statewide data that we received, plus we're adding in the vaccine rate data that we're receiving from Toyabe for vaccines administered within Inyo County as well. So last week we were at 72.2%. This week for our overall coverage rate, again, that's the number of individuals who have at least one dose, we've dropped down to 69.8%, but that's because our denominator increased. When we compare that to the state's coverage rates, state of California is at 60.8%. So really across the board, we saw an overall decrease in coverage rate as we increased the number of people eligible. And again, because that's happened so recently, we haven't been able to reflect a lot of those newly eligibles receiving their vaccine. However, I am happy to report that not only are we doing really well overall with our coverage rates, we did have the opportunity to open up some additional first dose appointments in our mass vaccination clinic at Tri-County Fairgrounds over this past weekend in Bishop. And we ended up having an additional 158 people receive their first dose of Pfizer vaccine over the weekend. So that was a good opportunity to get a jump start. A large number of those were adolescents. So we did see families taking advantage of that opportunity to get their children age 12 and over vaccinated. We are working through a concerted effort. We have wonderful partners in Inyo County in the healthcare system, and we've not only continued to have vaccine available through many, many different agencies or healthcare providers within our communities, but we are working on getting more Pfizer out to those providers. Many are working on plans for how to manage that vaccine. Again, the logistics of that Pfizer vaccine are quite challenging. We are very close to having more appointments open up. If not this week, then certainly next week we will be there working through trying to get that vaccine safely moved from freezer to freezer and into refrigerators to be available in the public. So we're working through a lot of the logistics on that. Very much focused on having more Pfizer open up, and we'll be seeing that soon. So we will continue to provide updates on the Inyo County website and also through our weekly email update that is released. Continue to get that information out as we're able to open up those appointments. But do want to just let people know that we still do have an ample supply of Moderna vaccine for those 18 and over. Several providers throughout Inyo County providing those Moderna vaccines. We also have both Dwayne's and Rite Aid providing the Janssen vaccine, the single dose vaccine for anyone who's interested in receiving that vaccine as well. We are still working on getting some of that Janssen or Pfizer out to some of our more vulnerable populations, and have been working through some strategies for that throughout the last couple of weeks as well, including working with the state on identifying homebound individuals who need to have that vaccine brought to their homes. So we're working through scheduling those types of smaller focused vaccine appointments through public health in the coming weeks. I do want to mention that we were scheduled to be in Lone Pine this week for a second dose Pfizer clinic. So we are going to be doing that on Thursday afternoon at Statham Hall. We have been able to open up some first dose appointments for that clinic as well. So we will have at least 36 appointments of first dose available in Lone Pine Thursday afternoon, that's May 20th. Those vaccine appointments are live on the myturn.ca.gov site. So individuals who are interested in registering in the Lone Pine area will have an opportunity this Thursday. We are getting that information out to our school superintendents this morning as well. So hoping to get that information out through the schools to families in those areas and get those appointments filled for Thursday. And then again, we'll be updating our information as we bring additional Pfizer clinics online to be more regularly available and convenient for individuals who are looking for that vaccine.
And then, Anna, I do think that we need to ensure that your board and the public are aware that, and just reiterate what the current face covering requirements are in the state of California, because there's been a lot of confusion. And the CDC recommendations did change last week as it relates to fully vaccinated individuals and their ability to participate in indoor and outdoor activities without face coverings. This you know, that is true, that guidance did come out, and that is what it indicates, but it also indicates the caveat that dependent upon state and local requirements. So the state of California did issue a release yesterday confirming that the current guidance that they issued on May 3rd remains in effect, and they're not changing it at this point. They are going to be using the period of time before June 15th, when the plan is to move beyond the blueprint for a safer economy, to determine what specific modifications they're going to be making at that point. So while they're not making any modification right now, you know, there is a potential in the future before June 15th for that to occur. So what this it means, of course, is that if you are outdoors and you are fully vaccinated, you do not need to wear a face covering. Or if you are a person who's not fully vaccinated, the face covering doesn't have to be worn outdoors unless you cannot maintain distance. But the indoor requirements for face coverings remain in effect. So we just wanted to provide this, take this opportunity to provide that clarification. And then Dr. Richardson, if there was anything you wanted to add.
Yes, good morning, board. Like was said, we had a great vaccination clinic at the fairgrounds this weekend. Turned out really well. I suspect there's going to be more eligible individuals that want to get vaccinated, because a lot of college campuses are requiring students to be fully vaccinated before they enter the fall semester on campus activities and in classroom face-to-face learning. So there should be more individuals coming forth for those vaccinations. And when I look back over the past 3 months, I could recall having meetings 3 months ago and looking forward to this day when we're close to herd immunity. And the numbers suggest that we are at 70%. So the state says there's only 2 out of the 58 counties that are approaching herd immunity. I'd like to know which 2 those are, because I think ours is. And when I look back at the feelings of the community, which was despair and confusion 2-3 months ago, it's now optimism and relief, which is really a good sign that we're really doing the right thing, getting as many people vaccinated as possible. And there's a lot of people in the background that have made this all possible, and they should be thanked. They're the unsung heroes of getting all this done. So having said that, I'm looking forward to getting more people vaccinated, but I think we're getting close to all the ones that should and want to get vaccinated in our county. I'm sure there's going to be more, but I think at this point, we're probably at herd immunity. The numbers suggest that. This masking issue is a confusing issue, masking, unmasking. I noticed that individuals are probably looking at the CDPH, not the CDPH, but the CDC guidelines. They're focused in on the positive result from the CDC guidelines. So it'll be interesting to see what happens on June 15th, what our state comes up with for guidelines. Masks are still going to be required in the schools throughout the calendar year, according to the state. So at this point, I think our county, and it's very pleasing to see that I think we're doing quite well. We've come a long way over the past 3 months.
I just want to make a quick clarification, and I may be incorrect here, but I think, Dr. Richardson, you said through the calendar year, and I think we're talking the current school year for sure for face coverings.
Yes, it's still requiring masks throughout the rest of this calendar year.
This school calendar year through.
Yes.
Through, yeah.
That's Dr. Galley's statement recently.
And Anna, I noticed that, or at least on the state's page, it says that we still have, I think, 4,000 something doses on hand. Are we are we getting any new allocations, or are we just, rolling with what we have on hand?
We've had a few second dose allocations come in over the last couple of weeks, but we have requested to not continue to receive new allocations for, I believe, the past at least 3 weeks, because we did get 2 boxes of Pfizer prior to last month. So we are flush with our Pfizer vaccine and are just working through getting more of that out in the community. All of our providers have ample supplies of Moderna right now. We have seen a little bit of a we did see a little bit of a downturn in interest. We're having trouble filling the clinics for the eligible population for our Moderna. So we have not been taking additional allocations for the past couple of weeks while we get through those allocations on hand. So we do have quite a bit of vaccine on hand through all of our providers in Inyo County right now, and have lots of appointments available for Moderna. Working on getting more Pfizer out there.
Okay, great. Does anybody have any questions for the medical side? Yes, Mr. Baltaro.
Now I'm unmuted. At what point will we be reassessing our safety requirements in light of the state maybe changing things on the 15th? Are we going to be ready to look at what we want so we could be consistent with them? Or not if we shouldn't be?
Yeah, we do have a couple of orders in place locally that we are going to be looking at to ensure that we remain consistent with what the state guidance says.
And there's nothing in Inyo County that would make us think that we're needing to be inconsistent with what the state might do.
Not that we can see at this point, but we've already started looking at those couple of items and assessing what our next steps are.
Good, thank you.
Do we know much more about what the state guidance will be after the 15th, or is that still? Yeah, okay.
Yeah, it's still in planning, I believe, so we don't have a lot of detail yet.
Yeah.
They're likely to address the larger gatherings, in particular indoor large gatherings is what we're hearing, but we haven't, the actual guidance has not been released yet.
Okay. Are we still giving out Johnson & Johnson, or how is that? And then I haven't gotten much input from Southeast County requesting, another clinic or anything. I wondered if you had, and and then also the Johnson & Johnson, if we're still using that or what's going on.
We are still using Johnson & Johnson vaccine or Janssen vaccine. We do have a couple of pharmacies in the Bishop area that are receiving that through a federal allocation, and that's available to the community at large. We still have some Johnson & Johnson vaccine at Public Health that we are working on some smaller focused clinics to have available. We have not made specific plans about getting back out to the southeastern portion of the county, but we are talking. In fact, I have a call, and I'm sorry, I can't remember if it's today or tomorrow, with the state's testing task force, where we're looking at the potential to utilize some of our testing resources for mobile vaccine outreach. That has not been completely confirmed or worked out, but we may have some additional mobile resources, and have already been talking about the potential to use some of those mobile resources in some of our more isolated communities. So no definites or timeline yet worked out, but we are looking at some other options to allow for some more mobile vaccine outreach, including to the southeastern portion of the county.
Yeah, and I guess the one thing that still makes it a little difficult is that the Johnson & Johnson, I mean, if you were going to go to Southeast County, it'd be nice to be able to do 12 and up, and you can't really do that with the Johnson & Johnson. And so you're still restricted in some ways by what you could do there. But it seemed like it would be great to be able to offer some opportunities out there, although I wonder if it's if they're having good success at just going to Pahrump, if they're in a similar situation as we are, in that you could almost get walk-in vaccination at this point.
We have had some preliminary conversations around school-based outreach, and I do not have any specifics yet to report, but I do agree that it will be helpful to make sure that our younger individuals out in that are attending Death Valley Academy or out in some of those harder to reach areas of our county, but closer to Pahrump, that we'll want to be looking for the options for them as well. So we're starting to look at planning for that through the summer.
Thank you.
I had a question for Dr. Richardson. Last week you had mentioned with regards to the emergency use authorization for children 12 to 16 that we might want to consider some sort of a policy. And I was just wondering, I had some questions about that. I was wondering if you could reiterate what you had said or advised with regards to younger children getting the vaccine and what we might want to consider as a policy.
Well, yeah, this is a very, very touchy issue. The ACIP, the Advisory Committee on Immunization Practices, gave a very good stance and position on why we should go ahead and vaccinate 12 to 15. That was a very good argument and hard to overcome. My position was at that time that the 12 years old and up can get vaccinated as long as the family, that is the parents or guardian, have full knowledge of the vaccine that is under emergency use authorization, and it is not yet registered as a FDA accepted vaccine. It's still under the emergency use. Now, we have been trying to do that with a sheet of paper. I noticed when we were vaccinating over the weekend, how to get that message out so it's clear. I'm not sure. I think a lot of parents and family, there's driving forces. They want to get their children vaccinated for various reasons. Many of them are for vaccine passports. And that's driving a lot of situations through this country about getting vaccinated. You can't go to college without a vaccine. You can't go to summer camp without a vaccine. So as long as the families are aware of the vaccine, it's not fully studied. It's still going through studies. For instance, in the UK, Pfizer did a recent study showing that you could get 2.5 times the immunity if you wait 12 weeks after the first dose. Now, the approval was based on a 3-week interval. So what I'm getting at is there's ongoing studies that are constantly being evaluated with the vaccine. And my concern was making sure the parents were aware. How to do that specifically, that's the point. That's a hard one to overcome.
And I'll just add that we do have, I want to say it's about an 8-page information sheet specific to the Pfizer vaccine emergency use authorization that is widely available as individuals are signing up for vaccine. It's linked in the MyTurn system and also available on Pfizer's site and CDC site. And we have those paper versions available as well as we're handing out vaccine. In fact, all providers are required to provide vaccine information statements. And in this case, it's a packet of emergency use authorization information. So that is one way we're making sure that as families are making decisions about vaccine, that they're getting some information about Pfizer specifically. And we did see over the weekend that many families are choosing to read through that information and authorize the vaccine for their children.
So is there any benefit to messaging the fact that when parents are considering the vaccine for their child 12 to 15, that they perhaps do it in consultation with their medical provider first? Is that warranted, or is that, it seems like that should be something that they should be discussing with their children's physician. And are we messaging that? And do they have to go through my turn? Can they go directly through their physician to the vaccine?
We would absolutely encourage parents and guardians to speak with a trusted physician and have, and have that additional conversation. And, we can provide the information and the resources, and it is always a benefit to have a conversation with their doctor. And Dr. Richardson, I think you indicated that last week also.
I believe so. I don't remember exactly all the words I said. I was just concerned that looking at the study, there was only 2,200 students in that study, or children from 12 to 15. And the vaccine was safe and 100% effective. So it's probably a very, very good vaccine all around. But we're still in the early phases of ensuring that for the long term. I think it's the long term that nobody knows about. There's still ongoing studies to evaluate it.
I'll add to that in conversations specifically with Northern Inyo Hospital, where we do have a pediatric clinic in the Bishop area there. I know online they've posted some additional information on the Northern Inyo Hospital website, and the pediatric office is also providing some additional information. So they've also been monitoring closely and trying to get some information out to their patients without necessarily requiring an in-person conversation, which I'm sure they're also available to do for their patients. But I know they're also trying to get some information out and available online through their website as well.
One of the issues that it concerns me, and I can see, the mindset. I've had that too. If somebody in the government says you should be doing this, people just fall in line. I think that's a good thing, as long as they're well informed.
Yeah, and I guess that's why I bring that up, because it seems to me that you've all addressed it here, and I just wonder how widespread that message is out. For people that don't listen to the board meeting, and anyway, it sounds like the information is available, that it's important to have that discussion with a medical provider that you trust. So
I see that we have a hand raised. Can we promote Wes French, please? You can unmute yourself and
Can you hear me now?
yes, we can.
Yes, good morning, council and health officials. Thank you for your efforts in navigating this COVID situation. I have concerns about the vaccines, as many people do. And I've written a short paragraph that I'm going to read. It touches on some of the things you just spoke of, Dr. Richardson, so forgive me if I'm repeating something that you just said, but what I've written says that it's been over a year since 14 days to flatten the curve, and here we are still trying to defeat a virus that has a 99.9% recovery rate for the 50 and under age group. 99.5% for up to 70 years old, and 94% for those over 70. Had several states not forced infected patients into nursing homes, that 70+ survival rate would be much higher. the medical establishment has suppressed the most effective and readily available treatments in HCQ and ivermectin, which could have saved tens of thousands of lives. The Lancet report coming out against use of HCQ was retracted because it was false. The mRNA technology, though it has promising potential, is not FDA approved, as you just mentioned, Doctor, and is only allowed for emergency use. This is an experiment on the American people for a virus with a very high recovery rate and known treatments readily available. There have been many problems with the mRNA experiment, and the data will continue to roll out for years on its positive and negative effects. It makes no sense to administer this experiment on the majority of the population whose recovery rate is so high, even with the treatments being suppressed. The only time I would consider taking it personally in taking part in this experiment is if I was much older than the 61 years I am, or had some serious health contributors. Even then, I probably wouldn't. But why be so quick to experiment on our youth who have little chance of even getting the virus, much less dying from it? I would appreciate some logic on this from our health officials. And to add, we're not talking about the adverse effects that we're experiencing in our own county. And I wonder if you have any data on that.
Thank you for your comments. I think most of that was answered earlier. I don't know if there's anything that anybody needs to add or would like to add to that. Okay, thank you for your comment. Is the medical team finished with their presentation?
I have one other question for them. Sorry, just at some point, not today or whatever, but it would be, again, still interesting for me to hear, how either percentage wise or how it's going with high school kids, with, the 12 to 18 or 16 or 17-year-olds. I get that. Well, I think it's important that we're talking about it. I think it's also going to be important for parents in the fall to figure out where their school is at, or where where their kids are at for vaccination. Some may make decisions on what their kids go back to school or not based on vaccination rates, possibly, I don't know, but and I'm fully supportive of what Dr. Richardson is saying. I think parents need to be informed to make sure that they make their decisions for their kids that are the best ones. But also the schools are going to have to figure out, how that's all going to work in the fall in particular.
Okay, great. So Leslie, did you have anything to add?
Good morning, Mr. Chair and Board. I have nothing to add today. Thank you.
Okay, thanks. Thanks for the update, everyone. I see that there's a hand raised again.
Hello, can you hear me?
Yes, we can.
So the last part of my statement had to do with local adverse effects to the vaccine. Is there no data on that?
Do we have any data on adverse effects? I mean, I guess you would have to define adverse effects, but is there any comment that the health team would like to make on that?
I don't have the data right up in front of me. I'm not aware of any serious adverse effects. I do believe that early on we had a couple of reactions that would be similar, and I'm going to look to Dr. Richardson. Similar to allergic reaction, but nothing significant, and certainly no deaths or other significant adverse effects to report. I will need to go back and see if there were any actual reports out to the federal vaccine adverse reporting system to see if we have any out of Inyo County.
As far as I know, we've had no serious side effects to the vaccine. There are acceptable and known reactions, local reactions, and some systemic reactions. You may get a sore arm, little redness at the injection site. Some systemic symptoms are like a flu-like symptom that lasts 1 or 2 days. But most of the individuals have had minimal or none of those. As far as severe reactions, none that I'm aware of. Early on, like Anna was talking about, we had a couple coincidental medical problems. They just happened to show up at the same time that they were getting the vaccine. They were unrelated to the vaccine. So at this point, we have not seen that. I'm now talking about the Moderna and Pfizer vaccines. I haven't seen anything, any serious outcomes or reactions to the vaccine.
Thank you for that.
Okay, thank you. Thank you. We will move on from the